STS. How the treatment works. STS is a subdermal therapy system designed to administer body beauty treatments primarily for treating cellulite, but it also includes techniques for body shaping, reduced localized fatty deposits, etc. The STS unit combines the following therapies: MFM currents, phototherapy, red-orange LED light 627 nanometers, ultrasound at 3 MHz, lontophoresis, application of galvanic currents, a treatment carried out using the ultrasound head, non-invasive subdermal therapy, NIST, which is a vacuum treatment. All of these techniques produce their own effects that complement and enhance each other, providing optimum results for body beauty treatments. MFM currents are medium frequency currents modulated at low frequencies and are designed to stimulate the body. Due to the nature of these currents, which group into trains of impulses separated by intervals, they are capable of producing excitomotory effects when acting on specific points. This produces a muscle toning effect. But without a doubt, the most interesting effect is that this pulsating current causes small orifices or micropores to be formed in the membranes, which can be penetrated by the substances that surround them, the active ingredients in the G5 treatment gel. Therefore, it is mainly recommended for transcutaneous penetration of anti-cellulite and slimming products. As well as emitting MFM currents, STS can also be used as a phototherapy unit. Phototherapy basically consists of using light with the appropriate wavelengths for the treatment to be carried out. STS phototherapy causes a biomodulation effect which stimulates certain cell functions as well as inhibiting certain functions that may be increased. It is therefore a cellular regulatory mechanism. The ultrasound treatment consists of a mechanical vibration which is transmitted to the tissue at a frequency of 3 million times per second, producing some interesting effects. Thermal, heats the tissue. Mechanical, micromassage, which encourages membrane permeability, metabolic exchange, breaks up macromolecules and removes adherences. And chemical, depolymerization of mucopolysaccharides and fluidification of gel-like edemas. Always select the most suitable settings for the problem being treated. Beauty treatments are normally carried out using direct contact applications, that is, by using a conductive gel to connect the treatment head to the area being treated and keep it moving at all times. The main beauty applications of ultrasound lie in the eradication of cellulite, removal of adherences and stretch marks, and treatment of encapsulated processes. However, ultrasound treatment is also used to treat many different disorders of the musculoskeletal system: muscle contractures, muscular pain, arthritic pain, tendinitis, injuries to the ligaments and tendons, pain relief, and chronic anti-inflammatories. Galvanic current is used in STS in order to produce iontophoresis, that is, introduce certain active ingredients into the body. STS is prepared in such a way that the ultrasound head can be used to emit ultrasound vibrations and galvanic current simultaneously. This means that the US head can also be used as an active iontophoresis electrode, and that ultrasound and ionization treatments can be administered simultaneously when using a gel with ionizable active ingredients. This makes the ultrasound act in a faster and more intense way, with the added effects of the active ingredients of the G5 gel, which in this case is anticellulite gel. Because this treatment, known as sonophoresis, uses a galvanic current, it requires an electrode to close the circuit. This consists of a metal rod that the client holds in their hand, or a plate that is positioned near the area being treated. NIST is a suction technique that acts as a hypodermal level by carrying out an atraumatic negative pressure massage. Depending on the treatment settings and the type of manipulation, NIST has some interesting effects which include decongestion and drainage, mobilization of tissue, stimulation of circulation, improved tissue growth, muscular relaxation, skin exfoliation, improved elasticity, and smoothness of the skin. It is mainly used as an anticellulite treatment for localized fatty deposits, body shaping, and muscle contractures and pains. The most suitable head for the treatment should be selected, and depending on the desired effect, should be maneuvered in the following ways: linear motion, Big 8, Small 8, Zigzag. Suction percussion. Vibration motion. Circular motion. Pump. How to use STS. STS has two different applications. Each of its functions may be used manually: MFM currents and phototherapy, US and/or galvanic current, NIST, use of preset programs for different beauty problems for which the equipment indicates safe levels and settings for use of these functions. STS has 7 preset programs. 1. Soft cellulite. 2. Edematous cellulite. 3. Hard cellulite. 4. Mixed cellulite. 5. Drainage. 6. Muscle contractures. 7. Fibrosis and scars. Step-by-step treatment. Before deciding which treatment to use, it is important to have an initial consultation with the client and to create a full clinical record by carrying out a physical examination and asking the client about their medical history in order to correctly diagnose the problem and choose the most appropriate treatment. It is recommended to weigh and measure the client and take photographs of the area to be treated. The interview and the examination also allow us to rule out any situations that may contraindicate the treatment. In order to demonstrate, we're going to use a preset program for the treatment of hard cellulite, which uses all of the unit's features. The treatment should always be carried out on clean, dry skin, so the first step should be to suitably prepare the area to be treated. The different treatments will appear on the screen, which are shown on this screen or the next one. Select the required program by pressing the key next to it and following the instructions given by the unit. During the STS treatment session, the unit will indicate what needs to be done for each stage of the treatment. The first stage of this anticellulite treatment uses the MFM current and phototherapy. First, the treatment electrodes are prepared,